Welcome to Indian Anatomist. Individuals who want to pursue a career in medicine are welcome to check out the YouTube channel Indian Anatomist. Hello medicos. Today we are going to talk about the axillary artery, which is a part of the upper extremity or upper limb. Axillary artery is the principal artery, supplies the upper limb. In addition, it also supplies the lateral thoracic region, and takes part in scapular anastomosis. The axillary artery is the continuation of the subclavian artery. Subsequently, the axillary artery changes into the brachial artery, which serves as the primary arterial vessel, supplying the arm, forearm, and hand. In the axilla, this artery runs along with the brachial plexus, and is enclosed by a fascial sleeve called axillary sheath. The axillary sheath is a fibrous sheath that encloses the axillary artery and the three cords of the brachial plexus to form the neurovascular bundle. It is surrounded by the axillary pad of fat. It is an extension of the prevertebral fascia of the deep cervical fascia, from neck region. The subclavian artery continues as axillary artery, that begins right from the outer or lateral border of first rib, to the inferior border of teres major muscle. After that, it continues as brachial artery. Throughout the course, the axillary artery travels along with the lateral, medial, and posterior cords of brachial plexus. As it passes through the axilla, it is divided into three parts by pectoralis minor muscle. That is, number 1, first part, present proximal to the pectoralis minor. 2 is, second part, lies behind or posterior to pectoralis minor. And 3 is the third part, situated distal to the pectoralis minor muscle. Each part gives an equal number of branches, namely 1 from the first part, 2 from the second part, and 3 from the third part. Dear students, it is very important to know about the axillary artery and its relations, because it is closely associated with brachial plexus in the axilla. There are anterior, posterior, lateral, and medial relationships between each part. The posterior and lateral relations change from part to part, but the anterior and medial relationships stay the same, except few. If you cannot recall the relationships, just write down that the skin, superficial fascia, and deep fascia make up the anterior relations. In the same way, the axillary vein is always medial relation for all parts of the axillary artery. Now, we will look at the relationships between each parts of axillary artery. Relations of first part of axillary artery. The anterior relations are skin, superficial fascia, deep fascia or pectoral fascia, clavicular head of pectoralis major and clavipectoral fascia with its structures piercing it. Posterior relations are first intercostal space and its contents, first and second digitations of serratus anterior, and medial cord of brachial plexus. Lateral relations are lateral and posterior cords of brachial plexus, whereas medial relation is axillary vein. Dear students, the first part relations are completed. Hope you all get understood. Now, coming to the second part of axillary artery. As usual, the anterior relations are skin, superficial fascia, deep fascia, pectoralis major and pectoralis minor muscles. Posteriorly, the axillary artery is related to posterior cord of brachial plexus and coracobrachialis muscle. Lateral relations of second part is lateral cord of brachial plexus, and the medial relation is medial cord of brachial plexus and axillary vein. Finally, the third part of axillary artery relations are, as usual, the anterior relation are skin, superficial fascia, deep fascia and pectoralis major muscle. Posteriorly the third part is related to radial and axillary nerves, and 3 muscles from above downwards are subscapularis, teres major, and latissimus dorsi. Finally the third part's lateral relations are coracobrachialis muscle with musculocutaneous nerve, and the medial relations are medial cutaneous nerve of forearm, and axillary vein. Please take note of this animation, which displays the visibility of the medial, lateral, and posterior cords of the brachial plexus. The posterior cord is located in a deep position, relative to the axillary artery, while the medial and lateral cords are situated on the medial and lateral sides of the artery, respectively. Dear students, the axillary artery rests slightly medial to the cords of brachial plexus in the axilla. It is critical to understand that the cords are located posterior and lateral to the first part of the axillary artery. At second part of axillary artery, the three cords are then positioned in three locations, with the exception of the anterior. Because of these relations, the brachial plexus cords are referred to as lateral, posterior, and medial. Whereas, at the third part of the axillary artery, these three cords of the brachial plexus begin to give rise to branches. As a result, third part of the axillary artery is only related to brachial plexus branches. The axillary vein is the consistent relationship on the medial side of the axillary artery over its whole length. Dear students, till now we have discussed about the course, parts, and relations of axillary artery. Now I am going to discuss about the branches. Branch from first part of axillary artery. Students, the first part gives one branch. It is superior or highest thoracic artery, smallest among the branches of axillary artery. Arises close or proximal to the outer border of scalenus anterior muscle. It gives muscular branches to subclavius, intercostal muscles of the first intercostal space, upper 1 or 2 digitations of serratus anterior, pectoralis major and pectoralis minor. It also gives cutaneous branches to skin over the first intercostal space. Branches from second part of axillary artery. It gives two branches. First is thoracoacromial or acromiothoracic artery, arises immediately posteromedial to pectoralis minor. It descends slightly along the medial or superior border, and then it pierces the clavipectoral fascia from deep to superficial, where it divides into four branches. They are clavicular, pectoral, acromial, and deltoid branches. Medicos, please remember the mnemonic, APCD instead ABCD. A stands for acromial, P for pectoral, C for clavicular and D represents the deltoid branches. Next branch is lateral thoracic artery, also known as external mammary artery, arises from second part, and goes along the lateral or inferior border of pectoralis minor, and subsequently serratus anterior. It is larger in females. Finally, it anastomoses with branches of subclavian, intercostal, and superior thoracic arteries. It supplies the lateral part of mammary gland, pectoralis major and minor, subscapularis, and serratus anterior. Finally, the third part gives three branches. The first is subscapular artery, largest but shortest branch from axillary artery. It runs for a small distance, along the lower border of subscapularis muscle, and bifurcates into circumflex scapular artery, and thoracodorsal artery. The circumflex scapular artery course around the lateral border of scapula, and enters the infraspinous fossa, via upper triangular space, where it joins with scapular anastomosis. Next is thoracodorsal artery, runs along with thoracodorsal nerve, and supplies the latissimus dorsi muscle. Second branch from third part is anterior circumflex humeral artery, is smaller than the posterior. It travels through the anterior surgical neck of the humerus, beneath the coracobrachialis and short head of the biceps brachii muscles, and anastomoses with the posterior circumflex humeral artery. It sends articular branch to shoulder joint, and small ascending branch to humerus head, via bioccipital groove. Last branch from third part is posterior circumflex humeral artery. This artery runs posterior, and towards the surgical neck of humerus. Then it winds round the neck, from posterior to anterior, by passing through the quadrangular space of scapula. Finally, it makes anastomosis with anterior circumflex humeral artery, and gives an descending branch to profunda brachii artery. In the surgical neck of humerus, it accompanies the axillary nerve. It gives blood to the shoulder joint and the deltoid muscle. Dear students, it is the time to discuss about the applied anatomy of axillary artery. First one is axillary artery aneurysm. Aneurysm means dilatation of arteries. First part of axillary artery may prone for aneurysm, that compresses the trunks of brachial plexus, thus causing pain and anesthesia, or loss of sensation, along the area supplied by the branches of brachial plexus. Number 2 is pulsation of the axillary artery, can be felt against the lower lateral wall of axilla, during brachial plexus block. Number 3 is compression of axillary artery. Now, why this artery is compressed? The axillary artery can be compressed against humerus, close to the lower part of the axilla, to stop bleeding. And the last one is scapular anastomosis. Around the scapula, especially on dorsal surface of scapula, there is rich anastomosis is formed between the branches of first part of subclavian artery and third part of axillary artery. It functions to allow blood to flow around the scapula and shoulder joint without any disturbances during injury or occlusion. The branches that contribute include transverse cervical artery, branch of thyrocervical trunk of first part of subclavian artery, suprascapular artery, also a branch from thyrocervical trunk of first part, or direct branch from third part of subclavian artery, subscapular and circumflex scapular arteries from third part of axillary artery. In addition to scapular anastomosis, there is minor anastomosis situated over the acromion process, called acromial anastomosis, formed by the branches of thoracoacromial artery, posterior circumflex humeral and suprascapular arteries. Dear medicos, I hope you all understand about the axillary artery, and its parts, relations, branches, and applied anatomy. Axillary artery is one of the important question in upper limb. I hope you all have enjoyed the session. Please like, share, comment, and subscribe. Good day all.